What does access to medicine mean to you? For me, it means that the patient gets the right drug at the right time and at the right price. Does this always happen in sub-Saharan Africa? We'll get to know. My name is Dr. Eva Amoy. I'm a regulatory affairs pharmacist working in the sub-Saharan African region. The moment the product is registered and you get your registration certificate, it does not mean that now the product is accessible to patients. What it means is that you can now start the process of bringing the product into the country. Now, the process involves a lot of elements, and just to summarize, it could be manufacturing, wherever the product is manufactured. If it's manufactured in Kenya or in country or outside of the country, manufacturing is one of the processes. And manufacturing could actually take long, because even in manufacturing, you have to order the different ingredients that make up the product and plan for it. So you'll find that manufacturing does not happen as fast as we cook our food. It happens over time, and it could even take 3 months to manufacture batches of products that are coming into the country. Then it's distributed, it's transported into the country, or if it's manufactured in the country, it's distributed from the factory into the distributors, then into the wholesalers, and then into the retailers, into the retail pharmacy. So it's a whole distribution supply chain kind of element that we need to consider here. And here there is also an element of pricing because the distribution is expensive and the product must reach the patient at an affordable price. So you'll find there's a sweet balance that we put between the pricing of the product so that it's profitable and the pricing of a product so that it's also affordable, right? And then the storage of the product. When it gets to where it's supposed to get, and even during transportation, it must be stored in the correct conditions. So whenever you look at your product, whatever product you have, whether it's something for pain or something for your stomach or a hypertensive product, there's always that part where it says store below a certain temperature or in a cool, dry place, and these things must be observed. Our regulators are very strict, and they have insisted that we must maintain these conditions so that the product, by the time it's reaching the patient, is still maintaining the same quality. Some of the issues that we face in my setup, especially the sub-Saharan region setup, is high prices of products, weak supply chain route. There's also a difference. You can find a product in the urban area and in the rural setting it's not there. So you'll find that people always travel to the urban areas to get their products and go back to the rural setting, maybe because a stockist is not stocking it in the rural setup. So I feel that some of the elements of access, right, are not quite realistic, especially in the sub-Saharan region, and we need to work on them. Follow for more. Thank you.